Good afternoon. I'd like to welcome everybody to today's webinar, Supporting Families and Caregivers of Infants and Young Children Surrounding the COVID-19 Pandemic. And I just wanted to start by saying that I hope everybody is safe and healthy, and I know that these are very trying times for all of us. My name is Evelyn Blank, and I am the Director of the Training and Technical Assistance Center and very pleased to welcome you all today. So I just wanted to start with a brief introduction about who we are. I'm going to be joined today by Dr. Joy Osofsky and Dr. Gerard Costa, and this is being sponsored by TTAC. And New York Center for Child Development has been a major provider of early childhood mental health services through both federal, state, city, and philanthropically funded programs in New York. We also have a long history of providing system-level expertise to inform policy and support the field of early childhood mental health through both training and direct practice. The Training and Technical Assistance Center, New York Center for Child Development, was selected by the New York City Department of Health and Mental Hygiene under Thrive NYC to develop a citywide early childhood mental health training and technical assistance center, otherwise known as TTAC. And New York Center's subcontractor in TTAC is the New York University McSilver Institute for Poverty Policy and Research, who house both the Community and Managed Care Technical Assistance Centers, otherwise known as CTAC and MTAC, which offer clinic, business, and system transformation support statewide to all behavioral health providers. And TTAC is tasked with building the capacity and competencies of mental health and early childhood professionals, and we do this through training and ongoing technical assistance. And I wanted to direct everybody to our website, which will be an ongoing resource for you to really hear about past events, learn about upcoming events, and also to access our archived webinars. So please, I encourage you to go to ttacny.org and to really become part of our learning community. It is now my pleasure to introduce our co-presenters today. Dr. Gerard Costa is a longstanding friend and a very esteemed colleague who has served on the advisory board of New York Center for Child Development. He's a licensed psychologist and holds a clinical mentor endorsement through the New Jersey Association for Infant Mental Health. He is the founding director of the Center for Autism and Early Childhood Mental Health and a professor in the Department of Teaching and Learning at Montclair State University. He was also the founding director and led the YSC Institute for Infant and Preschool Mental Health from 2000 to 2011. He is a professor in the Department of Teaching and Learning in the College of Education and Human Services and is a member of the faculty of the Infant and Early Childhood Development Ph.D. program at Fielding University, which was formerly the ICDL Graduate School. He serves as a trustee and president of the Interdisciplinary Council on Development and Learning and served as a consultant to 0 to 3 for the past 20 years. Since 2018, he has served as the coordinator of the Northeast Regional Terrorism and Disaster Coalition. He has presented worldwide and published in the areas of autism and infant and early childhood mental health, and received numerous awards for his outstanding work. Dr. Joy Osofsky is a clinical and developmental psychologist with the Paul J. Ramsey Endowed Chair of Psychiatry and the Barbara Lehman Professor of Child Welfare, which is at Louisiana State University Health Sciences Center, which is located in New Orleans. She's also the founding director of the Harris Center for Infant Mental Health. Dr. Osofsky has focused her work on the effects of trauma on children and families and ways to help and support them at difficult times, with special concern about the effects of disasters. She has published widely in the field, as well as providing leadership, and served as past president of 0 to 3 National Center for Infants, Toddlers, and Families, and the World Association for Infant Mental Health. She also played a significant leadership role in the Gulf region following Hurricane Katrina and in the Deepwater Horizon oil spill. Currently, she is co-principal investigator for a National Child Traumatic Stress Network, the Terrorism and Disaster Coalition for Child and Family Resilience, with an important objective to create regional coalitions among key stakeholders within terrorism, vulnerable, or disaster-prone areas to enhance regional behavioral health response for children, families, and community. Dr. Osofsky has received national and international recognition for excellence in her work related to trauma and infant mental health. I wanted to say that today's webinar is being co-sponsored by TTAC along with the Terrorism and Disaster Coalition for Child and Family Resilience, and as I mentioned, a center in the National Child Traumatic Stress Network at Louisiana State University. And Dr. Osofsky is the co-principal investigator on this initiative. And it was also sponsored by the Northeast Regional Terrorism and Disaster Coalition, a member of the TDC4 at Montclair State University, New Jersey, which is coordinated by Dr. Costa. And this includes key stakeholders from New Jersey, New York, Pennsylvania, Connecticut, and Delaware. So I want to thank Dr. Osofsky and Dr. Costa for their foresight and leadership in developing these coalitions, which really enables us to proactively develop resources and supports which are so valuable in the face of a crisis such as COVID-19. So I'm thanking them in advance for their generosity in sharing not only their extensive expertise, but also their experience. So I now turn it over to our co-presenters.
So both Joy and I thought this was a wonderful slide for us, boy, especially at this moment, right, where we're feeling a little frantic about the technology. But of course, the backdrop is of course greater anxiety. And so the Dalai Lama reminds us that even at times of great difficulty, we can really grow in wisdom. And I hope all of us can find some relief in knowing that we will get through this and grow even.
Okay, so I'd like to set the context with Dr. Gerard Costa, my close colleagues. We would both want to emphasize today is, first of all, our thoughts are with each of you. And we have much hope that you, your families, and loved ones will stay healthy and safe for everybody on this webinar. A very important message from us. For Dr. Gerard Costa and me, it's a privilege for us to be able to share what we know and have learned from others about ways to help young children and families, as well as caregivers, help children at this very difficult time. We also want to very much thank Evelyn Blank for her leadership, her vision to organize this webinar and support the presentation at this really difficult time for all of us. Gerard Costa and I have known each other for many, many years, for reputation before we knew each other and collaborated before. However, our collaboration has grown with the development of the Northeast Coalition for Child and Family Resilience in the face of disasters and terrorism and other critical events. We're very grateful for the opportunity to become close friends and colleagues that I mentioned. It's deepened with our collaboration on this presentation at this very difficult time. We have learned, and we hope to share with you, how very important close connections and sharing are in being able to help others at difficult times, like what we are facing now with COVID-19. Throughout the webinar, an important theme will be the importance of relationships for young children to cope with and overcome adversity. So we put together a roadmap for how we will proceed with our webinar today. We're going to talk a little bit about the changes in our world that you all know and experience, and changes in our personal lives brought about by COVID-19. And our focus will be on infants, toddlers, and preschoolers and families. We're going to talk about new routines to help support co-regulated and positive relationships. With schools closed, parental employment disrupted, relationships kept at physical distance. And you'll hear us emphasize physical distance, because even though it's talked about social distancing, it's really physical distance, because emotional closeness is crucial. And then we're also going to talk about the important area of self-care for adult helpers. And there's an emphasis on helpers. We're fortunate to live in the era of Fred Rogers, who talked a lot about helpers, and that we'll hear that theme throughout. For our work, we've very much learned from our pioneers. So Selma Freiberg always said, what about the baby? Are people paying attention to that? And then we all learned a lot from Jeree Paul, who said, and it's very important for us to think about, how you are is as important as what you do in making a difference for infants, toddlers, and their families. So we always worry sometimes about what we do and other types of things like that, but it's really how we are with them. And that's something that we'll be emphasizing today as well. So what's most important to help young children and families? What do children need? In stressful times, they need a secure relationship. We know that. And yet it's sometimes hard to create a secure relationship when we're also feeling anxious and concerned. So what do we need to do with young children? How can we help them? One of the things that's so important is to be present with them. We need to be able to listen to them, and we need to be able to quiet ourselves down enough to listen. And then basically help them feel safe and secure. And I remember very clearly from other disaster events that feeling safe and secure may be hard sometimes, but that's our role as parents or caregivers of young children to help them feel safe. I hope that you can see at the bottom of this, I see that the words aren't there. This was actually a cartoon that was in the New Yorker during 9/11, right after 9/11, and it says at the bottom, "Daddy, can I stop being worried now?" 9/11 was many years ago, but this is so relevant today. You see the news broadcast there, you see the little girl saying to her daddy, "Daddy, can I stop being worried?" I'm reading the comment that you can't see, and that's what it's saying. And we have to depend on parents and caregivers and others in our lives to help us feel safe. And that's part of our role. And if we don't feel safe, we still have to tell children that we're doing our very best to keep them safe. So it seems like our slides are a little bit cut off on the bottom, but I'll share with you what's on the slide. What's on this slide is really talking about the effects of trauma that we will be sharing with you. And essentially, if a child is exposed to trauma, it changes a child in many different ways. Biology, relationships, behavior and emotion regulation, which you'll hear us talk about a lot, cognitive skills and development. It's harder to learn if you're anxious, if you've been exposed to trauma. And then a lot of our focus is on social and emotional development. I see a comment that slides are cut off. I'm going through them because they're cut off. So, signs of baby or young children emotional needs aren't being met. Some of you may have seen a baby, a 6-month-old baby with no emotions, bland affect. We worry about that. We worry about the baby that doesn't make eye contact with us. We worry about lack of responsiveness and rejecting being held or touched. Those are all red flag signs in a baby that there may be a problem, as well as non-organic failure to thrive that fortunately doesn't occur that often. And then for preschoolers or toddlers, that's where you see a lot of the dysregulation. You can see it. You can see it if they are younger, but you tend to see more dysregulated, aggressive behaviors or withdrawn behaviors in toddlers or preschoolers. These are kids also who have difficulty sitting still and paying attention if there are issues going on, and I'm sure that you all see this occurring now. Difficulty with attachment, indiscriminate attachment, sleep problems, anything that's unusual for a child of this age. So for example, children of this age show temper tantrums normally, they hit, they do other kinds of things. And then we have to control those, but it's what's beyond usual for a child of this age. So disasters, and I've worked a lot with disasters, COVID-19 lead to an increase in stress. We don't have to tell you that, we all know that, we're all experiencing it. One of the things we're concerned about a lot of things with increase in stress, but we'll probably see an increase in domestic violence and child abuse. That's common following disasters. COVID is a different type, COVID-19 is a different type of experience, but it leads to an increase in stress. The other issue, of course, that we're having is children are at home, people are in confined spaces, there's been a lot of job loss, a lot of issues that lead to much more stress in families. Increase in use of alcohol and drugs. So how can we help children and families? What's important for them? Increased support. and you'll hear us continually talk about the relationship. A lot of us really don't particularly like the word social distancing. Social distancing obviously is very important to try to flatten the curve of the spread of the coronavirus at this point, but for children and families and all of us, it's better to talk about physical distancing because social bonds are so crucial. That is the way we support ourselves. That's the way we support children and families, is with social bonds and keeping our physical distance to keep safe. The slides are cut off on the bottom. I think maybe they're getting better at this point. So we're not only concerned about young children and families, we're also very concerned about the parents and caregivers, and you will be hearing more about that as we go along. One of the issues that we really need to pay attention to is parents or caregivers being so stressed that it's hard for them to listen or hear the child's concerns. You heard me mention earlier how important it is to try to be emotionally available and listen. So important to listen. I've talked to a lot of people I know who have young children, and I ask them how they talk to their child, and I ask them what they're doing, and they say they're listening to the children. And because we talk about how really important it is to hear what the child's concerns are. You know, you might not have all the answers, just being there to listen makes a difference. Unfortunately, we don't have the usual supports. The way we support ourselves at times like that, also the way we respond to most disasters, is reach out to other people and be there for them, and we can't do that because of the social and physical distancing. And then the dysregulated behaviors that we may be seeing in children right now are occurring because of all of the changes that are going on. Families are more stressed, children are out of school, people have lost jobs, so it's very difficult for the child to regulate at times, and then challenging for the parents under those circumstances. My slide is moving. Expectable reactions that we're going to see in young children with stress and trauma. And you can see that we've highlighted emotional and behavior dysregulation. That's what happens when the environment is chaotic. We don't have to tell you that. We know the environment is chaotic. Some of the things that we see with emotion and behavior dysregulation: frequent crying, difficulty falling asleep. Children may need more support in going to sleep now, difficulty staying asleep, and nightmares. I think some of us may have already been experiencing that. We see regressive behavior, more clingy behavior. We often see that after disasters. Fears of being alone. In play, someone was asking about what does play look like. Well, it's hard to play out what's going on with coronavirus because it's not something we can see. But with disasters, we tend to see children play out the disasters. It's what they do. It's the way they deal with it and the way they cope. Can also see anger and withdrawal. Some of the repetitive play we may be seeing here is some caretaking to handle the fears and the difficulties. So what helps? One of the things that you're going to hear Gerard Costa and I talking about a lot is schedules. We have a new normal now, and children really need predictable schedules. They need routines. So with schools and preschools and daycares closed, the stay-at-home orders, businesses closed, financial pressures, social distancing in place, it's hard to have a predictable schedule. However, routines are going to be very, very important for young children. So we have to think about new routines. So we can start with things that happen every day, but a new schedule, planning the day. And I know Jerry is going to be talking about, Gerard Costa is going to be talking about this also. Start with meal times and bedtimes. That's something that we have to do every day. if we're doing homeschooling, which a lot of people are, a time for schoolwork. And if the child doesn't feel like doing it that way or at that time, then adjust it a little bit, because some days they're going to want to cooperate and some days they aren't. That might be a time to stick in some playtime and time with a parent and caregiver. So it's very, very good. This is going to be our routine for the day, but also be able to be a little bit flexible. And then trying to be emotionally available, not just being there, but being able to listen. And even if a parent is possibly able to do it, schedule a playtime with the child and have the child choose what they want to play with. You know, it might be squeezing Play-Doh for 10 minutes or 15 minutes, something that allows them and you to relax together. The other thing that's very, very important is limiting exposure to media. On the one hand, we say you, as a parent or caregiver, somebody who's going to be available to a child, you need to know what's going on, so you do need to check with the media. However, it is traumatizing to hear the media reports over and over, and we get it on social media, we get it in television, we get it in radio, we get it on our iPhones. So limiting that exposure, maybe being able to do it once in the morning and once in the evening. So what can you do for young children? And I know I saw a question raised about older children. Some of the principles we're talking about are very important for older children as well. So all of the things actually that are on this list right now are important for young children, but work as well for older children. It's just that you might do them differently. Listening to concerns. So little children may not be able to tell you their concerns. They may tell you about their behavior, but listen to their concerns. So recently, I heard an example of a child being concerned about having to wash their hands, which is something that's gone on. And the parent said, "What's your favorite song?" And so let them sing their favorite song while they were washing their hands. So try to give a positive tone to the kinds of things. And then in terms of not being able to see their friends or go out and play with their friends, well, they can still go out and play, and they can play with friends as long as people keep a little distance from them. And it's just to keep everybody safe. So listening to their concerns and trying to reframe them in a positive way are really very important. Talk to them about the coronavirus in language that they can understand. One of the things that I had an opportunity to work on early on, that it's in our resource, our resources at the end, was to develop a comic. National Public Radio worked with some of us who work in the field to develop a comic that you can use to talk to children, directly to children, and then parents hear it too. But that's a language they can understand. And they also need to hear that few children have developed coronavirus. And if they do, it's usually mild. So to reassure them that the likelihood is they're going to be okay. Explaining to them why they can't go to school or preschool. It's a way to keep everybody healthy. That's one of the reasons they can't, and why they can't play the same way. They can go out and play, but have to keep distance from people. So it's really important to be able to talk with them about what is going on and be able to listen to them in this environment. I added this slide. I did a lot of the mental health work after Hurricane Katrina. And this little 5-year-old said that to us: "If I only had my room back, I'd be good." Well, it makes us think now, if I only could be back in school and play with my friends and do that, it would be much easier for me. One of the things that's really important is talking about positive connections that they can make with friends. With telephone, if you have availability of social media, being able to connect. So trying to kind of make a new normal for them and find alternatives where things could be better. I'm going to say just a little bit about adverse childhood experiences. I assume that most people, if not everybody on this webinar, knows a lot about adverse childhood experiences and the work that has been done, indicating that the more adverse experiences early in life can lead to more maladaptive ways. And the reason I bring this up here is for people who have had early difficult experiences, then going through COVID-19 and all of the stresses with that can lead to more maladaptive types of things. And we mentioned before, potential increase in domestic violence and child abuse and use of alcohol, tobacco, and drugs, increase in mental health symptoms. And those of us who are in the area of mental health, as I am, are trying very hard to have more availability of services and support for people under those circumstances. Unfortunately, this may be cut off at the bottom, but what we wanted to emphasize here in terms of maltreatment is that the 0 to 3-year-olds at the very bottom there are the age group where the rates of child maltreatment are highest. And that's one of the reasons we felt it was really important to pay attention to young children as well as older children at this time. And we've talked about ways to handle stress. You know, there's meeting new people is a little bit of stress, but it can help people develop resilience. If there's a death in the family or the kind of thing we're going through now, but there's support from a loved one, if there's support from somebody who cares, then people can handle that tolerable stress. But you can see the image of toxic stress with addiction or abuse or neglect that leads to many, many more difficulties there. So at this point, and one of the reasons I want to say that we've been emphasizing adverse childhood experiences is we've certainly learned about work in difficult times and disasters and other kinds of very negative events that they can build on each other. So that it's so important to listen, to be available, and to recognize that this may build on other stresses, but then be able to listen to the child and support them in talking about it. So I'm going to now turn the presentation over to my colleague, Dr. Gerard Costa, and then we'll come together again to talk at the end about self-care. Gerry?
Well, thanks so much, Dr. Osofsky. And again, it's such a wonderful opportunity to work with Joy on this. We have really, thoroughly found ourselves so committed to trying to come up with a presentation that we can do in such a brief amount of time. And so I'll kind of go quickly through this. And as I continue through the presentation, there may be times that I'll simply remind you that you will get the entire slide deck, following the webinar, and so we'll go from there. So one of the things that I wanted to, and both Joy and I wanted to really be sure we understood, was that children, very young children, are not immune from feeling the fear and the anxiety that's felt by the adults in their lives. They're not immune or protected because of their immaturity. So one myth is children don't remember trauma events, and if they occurred especially early in life. And so if they can't remember them or talk about them, it won't affect them. And of course, the truth is research shows us that frightening events affect everyone, including very young infants. And that when children are older, and particularly as they develop language, they can really talk about some of it, but prior to that, and even along with that, children often can internalize the fear and anxious states in their own bodies, so they can sometimes somaticize those experiences and even, in fact, reenact them in play in other ways. We often talk about the body remembers. The body can hold on to states like this, and so we'll talk about how we help babies at those times. Another myth is, this is the old, accentuate the positive, eliminate the negative. If you try to forget about bad things, and if kids try to talk to you about them, distract them or say something funny. And of course, we know that the reality is if they're discouraged from talking about their fear and anxiety, they can often become preoccupied and feel alone with their worries. And no one who is preoccupied with their internal life can really attend to themselves in other ways in the outside world. They may even appear to have difficulties in learning. Another myth, if children act out in hurtful ways, they're just being willful and can choose to stop the bad behavior. This is the variation of very young children are very intentionally misbehaving. Of course, the reality is that children feel higher levels of stress and fear, and that may increase their feelings of weakness and vulnerability. And sometimes, to help themselves feel better, they try to act out in strong ways, being aggressive or being controlling. And this is, in some sense, for them, an attempt at helping themselves. What they need are adults and relationships to help them organize and make sense of these feelings that they are authentically having. So we want to talk, therefore, about what fear does to a child by looking carefully at what happens through their eyes. So we're sharing this definition. This is a definition that I first, both Joy and I had the same reference to this, Steve Marin's at the National Center for Children Exposed to Violence at the Yale Child Study Center. An exceptional experience in which powerful and dangerous stimuli overwhelm the child's capacity to regulate his or her affective state. I think certainly what we've experienced now, this qualifies as a traumatic experience that's a collective shared traumatic experience, certainly not just for the young children, but for their caregivers. But how this changes children depends so much on their developmental level. And so we often see, as I said a moment ago, that children will often develop symptoms, including misbehavior and acting out. And I think it is so helpful for us to recognize that for children, it is an attempt to feel better. Whatever it does to them, their misbehavior, quote unquote, is an attempt to feel better. It's an attempt at somehow creating restitution and protecting themselves from these very scary behaviors. And we'll talk, feelings, and we'll talk about again in a moment. So the COVID-19 dilemma, again, when exposed to events like this and the difficult changes that have happened in their lives, recovery always is helped by having a positive, supportive relationship. For those who know about the circle of security for parenting, they talk about how parents need to be bigger, stronger, kinder. Parents and caregivers need to organize a child's feelings to make some sense of what they're really feeling underneath the behaviors. So I want to talk briefly about fear and the brain. Dan Siegel and other interpersonal neurobiologists have really helped us understand the changes that happen in brain systems. And one of the phrases that we borrow from those folks is this idea that looking at the child with the brain in mind. So for a moment, I want to talk to you about the infant and young child with the brain in mind. First of all, the brain, and this is a slide that you will look at more carefully. I simply wanted to say by 5 months gestation, 5 months pregnancy, the brain, the fetus already has 100 billion nerve cells, and about 20% of them are connected at birth, meaning 80% of them get formed through the nature of relationships. Relationships alter basic brain biology, and that's going to be part of why we talk about ways of caring for children. So I'm going to share this brain information with you by illustrating it through what I find to be a very benign event, the Jack-in-the-Box. Now, I hope all of you remember the Jack-in-the-Box. There we go. I hope all of you remember the Jack-in-the-Box scenario. And again, I'm going to say on behalf of all children, whoever had the idea that this was fun, right? Whoever thought this is a great thing to play with? It becomes play. It becomes funny only once it's put into context by the relationships in our lives who help us learn how to adapt to unexpected events. So this is a little picture of Dane, who's about to look at the Jack-in-the-Box for the second time. The Jack is being unfurled. He looks at his mother in anticipation of what's about to happen. The Jack suddenly pops up. He sees it fully. He then cries. And then what does he do? He looks right at his mother. And then what does she do? She swoops in and picks him up and comforts him and speaks to him softly. So, but little Dane has a brain inside. And that brain, in fact, is reacting in a certain way. So what's happening is his amygdala, this organ that kind of senses changes and dangerous events, sends a signal to the hypothalamus. And the hypothalamus sends a signal to the pituitary gland, and that dumps lots of hormones, chemicals into the bloodstream, and they change many other body organs, especially the adrenal glands, which pumps out adrenaline. And so fear immediately activates this H, hypothalamic, P, pituitary gland, A, adrenal process, the HPA process. And so what helps when children have this HPA process is the idea of having a relationship. This is a graphic from Colwyn Trevarthen, this wonderful British infant mental health specialist. And you don't need to understand the language simply to know that something happens between the parent and the child, moment to moment, millions of moments this happens. And in fact, this creates changes in each of their brains. A wonderful UCLA neuropsychologist, Alan Shore, says the mother's limbic system communicates directly to the baby's limbic system. And so when Dane's mother swooped in and helped him, she did so with a kind of attuning, regulating, caring demeanor. And so shortly, within a couple of times of doing this, look how Dane then looks at the Jack in the box popping up now. He looks startled, not overwhelmed. He looks at his mom very gleefully as if, yeah, I've seen this before, and I think you and I can manage this together. And he kind of celebrates with that idea. And his brain now is a very different brain. That brain, in fact, now is one that is open to experience. His limbic system isn't derailing his thinking brain. His survival brain is not derailing his thinking brain. So you can see his cortex is available for thinking and availability for reciprocity. There's no adrenaline rush. The HPA is not activated, and he even feels these elevated positive mood centers that are activated. So the brain is always working, always there. And so during this anxious time, not only do we think about infant and child brains, but your brains as well. What's going on in your brains? What are the take-home messages? We know that being exposed to heightened fear and trauma affects how a child reacts and even feels about him or herself. It actually changes the structure and functioning of the brain. And that means that the brain changes can create problems in regulating a child's own mood and emotion and behavior. And so we really need to help children on co-regulating. So we've emphasized a critical importance on supportive relationships. And so we want to talk a little bit more about the idea of how those relationships can help children around COVID-19. And again, we'll look even more later on. Joy will really help us talk about not only how we support the children, but how do we support ourselves, the helpers, the caregivers. So let's talk about this, responding to children in the COVID-19 world. I often give presentations, and I have a saying that in the beginning there was the relationship, and I would often say if I had a bumper sticker, this would be it. And my 32-year-old daughter, who's an occupational therapist, heard me present once, and she had these made for me, which was cool. So this is my real bumper sticker. It's not on my car, but it's in my office. But if I had a bumper sticker, it would say this. It's really about the relationship. And so we tried to summarize some of the aspects of the relationship in these 5 clear steps that speak about attunement and co-regulating. The first thing we have to do when a child is upset is feel the feeling with the child, be attuned to that child. Dan Siegel, I mentioned, says connect to the right brain, not the verbal brain, not the linear brain. Connect to the right brain. Don't ask lots of questions. Just feel the feeling and then move to the left. Use your whole body, your voice, your pacing, your movement, your gestures. Second, always be sure you are conveying safety and hope to children. When they are worried, the first thing they need to do is feel safe. And this is not a time for uncertainty. Children need to know that they will be safe with you, that you are doing everything you can to be safe. I've developed a strategy over many years, often with children on the autism spectrum, but for every child. When children are anxious, use the 4 L's strategy. That means use less language and wait longer latency. Just take your time. Try to really focus on the affective exchange. The 4th thing is find your calm. You're lending your calm to the child. Your face, soft voice movements can co-regulate the child. And I'm going to recommend you use an approach we refer to as the agile approach. And I'll show you that on the next slide. And 5th, as you can speak to children, find the words to help the child find his or her own words, to speak about how they are feeling. Don't begin with lots of words, but certainly find them at some point. So the affect, the agile thing is affect. Watch your affect. This is what a child experiences first and foremost. Be careful of your gestures. Modulate and be attuned to the child's feelings in your face, your hands, your movement, and your pacing. If you are upset and react with a level of upsetness that is not attuned to the child may in fact actually feel that your feeling is overwhelming them. So you have to help them. Intonation, by far one of the most important aspects of human functioning. There's a number of theories that talk about something called polyvagal theory, that children are feeling safe mostly based on the tone of voice of those who care for them. As I said to you, latency. Wait until the child takes you in, and only then engage the child. So agile is affect, gesture, intonation, latency, and engagement. We think it's kind of a good little strategy to follow. And we even made this into a little card. One of my staff members, Dr. Eileen McKeating, who's a real graphics specialist, developed this little card that we laminate and give out to people. So let me just summarize with a couple of other more concrete ideas. So there are 10 ways to calm an anxious child, and this is coming from a wonderful resource written by Elena Pachoda-Cohen and Barbara Warthall called Silent Realities, about children who've been through trauma. Respond quickly when you see a child's distress by showing interest in their feelings. Listen to what they're saying and with their words and their actions. Don't respond to just the actions, but what you think is underneath them. Take their feelings seriously, especially fear and anger. If possible, and you need to talk to a child privately if they're in a group, please do so, and then try to relax and co-regulate yourself. Restate what the child is saying back to be sure you understand it. Provide appropriate outlets, even hitting a pillow. Do not personalize the anger. It's not intentional. Comfort the child with extra hugs if they'll take it, and be there for the child. So you get the idea. And of all the things we have in our lives, Mr. Fred Rogers often talked about this. His grandmother would say to him when there are dangerous things that happen, look for the helpers. And I think that's the job. Even as you limit media, be sure you focus on the helpers. But let's talk about now you as the helper, what you have to do in terms of taking care of the people who take care of the children. And so I'll do 2 more slides and then turn this over to Dr. Osofsky again. So one of the things we're suggesting about routine, Dr. Osofsky mentioned this, is make quarantine routine. Build routines. Create a visual schedule that goes through things you're going to do. Get up, hygiene, personal hygiene, regular, calling grandma, feeding the dog, dusting the furniture, reading a book, mealtime, bedtime, whatever the things, have a schedule. It's wonderful. Be open to listening. Keep in contact with family. Make time for play, and make time to explain, obviously, what is happening to the child. So this slide, I think I'm going to just have it in the set to show you later. But these are some more strategies that can be used in terms of helping children even relax themselves and use some mindfulness. So what I'd like to do, and finally, because we wanted to be sure we thought about children with special needs, for them in particular, especially if their language is delayed, they really need ways to have their feelings felt with. And new routines help so much. Dr. Stuart Shanker, our colleague from Canada, says, reframe misbehavior as stress behavior. If you see misbehavior, don't see it as intention. So I'd like to turn it over now to Dr. Osofsky. Again, Joy, I hope I didn't take too much time. I tried to rush through those, but here you go.
Yeah, we felt it was very important, and we've tried to, as you can tell, set stage for what may be going on with young children and families, how it impacts on brain development, and what really can do to help regulate the child as well as regulate ourselves, which is why we're turning now to self-care. Self-care is very, very important in difficult, anxiety-provoking situations. I don't know about how you react. I can say, in terms of watching the news and hearing the news, the anxiety level goes up. So what else are we getting in terms of primary and secondary traumatization? What's going on? Loss of jobs, children out of school, decreased income, having to balance work and childcare and all the home care that goes along with it. Difficulty getting food, challenging with lockdowns and preparing 3 meals a day and cleaning up. What they talk about social distancing, physical distancing, which is really interfering with what we need right now in terms of helping to support both ourselves and children. So what is self-care? We all know self-care, but do we do it? How do we renew ourselves? We're the helpers. You know, Mr. Rogers talked about the helpers and being there, but how do we do that for ourselves to be available when we're under a great deal of stress and having to balance all these things? Obviously, health maintenance, which is a little bit challenging now because so much of it is done by tele, but being aware of what's going on with us and having balance and connection and being able to nurture ourselves without necessarily feeling guilty, because some self-care at this time is really crucial, even under very, very difficult circumstances. So we also want to point out the kind of risk factors that may be coming up for all of us. Worrying about our own health and that of our loved ones, having taken care of a loved one, being around people who are at higher risk. Fear that the pandemic will never end. I could be wrong, but I think many people on this call certainly would know, when is it going to end? When is it going to be over? When are we going to be able to get back to life as normal? Changes in our sleep and eating patterns. We keep talking about the need for new routines, but there certainly are those changes, difficulty sleeping and concentrating. For people who have health problems, certainly the anxiety also gets in the way of the health problems. And with that, what we do sometimes is increased use of things that are not that helpful for us, alcohol, drugs, other types of things. And we also talked about anger. What can I do? I feel overwhelmed. So we wanted to address that. Some of the things that we can do that are very practical. Take breaks from reading or listening to news stories. You know, it's a dilemma with social media, for those of you who use social media, because you connect with your friends that way, but then you get these bursts of new news coming. So we have to figure out ways to restrict that. We need to know what's going on in order to talk to our children and be clear with them, but hearing constantly about COVID-19 can certainly create more anxiety, so we just have to be clear to restrict that. And then some of you may say, I don't have time for self-care. That's just another pressure in my life. We recognize, certainly Dr. Costa and I recognize, it's difficult to find time to unwind and relax. But maybe at this time we can try to remember things that we do enjoy doing, even if it's for 5 minutes, something you enjoy doing. Certainly connecting with other people is really, really important. You may not be able to sit down and have a meal with them or even take a walk, depending on where you live. And we always have to keep distance, but talking with them about your concerns. And also, do not hesitate to ask for help. There is help out there. I can say as a mental health professional, we are doing our best to set up, and I know in a lot of places this is happening. There certainly are hotlines, but there is mental health via tele at this point, so there is help available, and don't hesitate to do that if that is an issue. So we want to point out people who are at greatest risk, and some of you are on this call. Parents and caregivers with all that balance, new responsibility and new routine, child care providers and teachers. Obviously, healthcare professionals, we know that. We know what's going on in the hospitals and the stress. People who work in the community and can't do things the way they usually do with their work. They have to do their work via tele, and that's very hard, and worry about how people are doing with whom they're supposed to intervene. I already mentioned healthcare providers and treaters. Media, people don't think of media. Boy, we learned that with other disasters. They have to take pictures all the time. Don't have any way to process that. Reporters who have to tell stories all the time. And they don't get a way to get away from it. And then, of course, we know first responders, police, firefighters, EMT are on the front line all the time. And trauma is a big issue. And judges who have to deal with many of these very difficult issues. We see the increase now in child abuse and domestic violence. Someone has to deal with that to try to help families and help support their children. So I'm going to turn it back to my colleague, Dr. Gerard Costa, who's going to talk a little bit more about what can we do? What are the strategies for self-care? And you can see our little teapot on the stove. Jerry?
Great. So we're going to try to bring this home quickly because I know we're reaching the end. And I think because we started a bit late, I am hoping that we can have some questions. So what are the ways you can help yourself? And so these categories obviously speak about how stress is really the target of what we need to think about reducing and all the ways we can. And I'll suggest a few. Certainly, we know that in times of stress, when we feel anxious and less safe, we are drawn to social support. And as Dr. Osofsky said earlier, social distancing doesn't mean emotional distancing. And this is some of the ways that we are discovering some of the real gifts of technology right now. For those who understand what reflective practice is, that ability to be able to scan yourself for what's happening inside of you as you care for others, as you are engaged in your helping professions. We're going to talk about mindfulness in a particular way and deep breathing together. So let's get to some of this. So mindfulness even for children. And so children, I have been amazed. And we have a fellowship at our center at Montclair State, an Infant and Early Childhood Mental Health Fellowship. We actually have been working with our team, with our students, to really think about mindfulness, and some of them have really been practicing it with their 2-, 3-, and 4-year-olds. And I am so amazed, and some of you may know this already, how young children can learn to do deep breathing. One of our students said that her daughter was quiet once, her 2.5-year-old or 3-year-old, and when she asked her daughter what she was doing, her daughter said, "I'm just trying to keep my amygdala quiet." And there are ways this can happen. So this is just an example of mindfulness for children. For you, as well as children, there's a technique that's often called the 4-7-8, which is you empty your lungs of air. So breathe out, then breathe in for 4 seconds, hold it for 7 seconds, and then exhale as deeply as you can, because when you exhale, that triggers the parasympathetic nervous system that brings the relaxation response. And do this 4 or 5 times. It's a mini vacation. It's a wonderful way to help yourselves. I think we both realize. And both Joy and I got a kick out of this cartoon. And by the way, just coincidentally, there's been lots of stuff written about how dogs and cats are wonderful companions at these times, but the key to meditation is learning to stay. And with all of the busyness and noisiness inside of us, it's a great reminder. So Joy will close with this wonderful Maxims, these wonderful Maxims.
Yeah, we put together these Maxims for caregivers that I think are really important to bear in mind, particularly at a time as stressful as all of us are feeling, the stress that's going on, the uncertainty. So to think about as caregivers, giving to others gives us a sense of satisfaction, but we must also be sure to give to ourselves in order to be able to give to others. When we take care of ourselves, we're better able caregivers of others. And that's something to think about. It's not selfishness, but it's a sense of we do have to figure out a way to take care of ourselves. I know it's really hard at this time, but all of us, many of us are caregivers and need to be able to do that. And it's our responsibility. It's our responsibility to those we care for to take time to rejuvenate ourselves. And finally, setting healthy, realistic limits for ourselves will then allow us to support others. We want to emphasize how very important it is for us to continue to find ways to form relationships that will be supportive, because that's one of the ways that will help us go forward in a very positive way. I think you've seen that modeled with Dr. Gerard Costa and myself, and we did all of this in different ways, with telephone, with email, with Zoom calls, so as well as our collaboration with Evelyn Blank to make this happen. And I think it's very important for us to think about. So we thank you very much. We also have a lot of resources for you that we put here for you, and do not hesitate to get in touch with either of us to follow up. And then we put together this infogram here that talks about just the kinds of things that you can do for young children, and you'll see more resources like that are available as well.
And Dr. Osofsky and I literally have visited each and every single one of these links, so we think they have value. There's a particular one we wanted to draw you to, where Dr. Osofsky did an interview for NPR, and they developed a comic book for children that you could actually download and fold about coronavirus. It's wonderful.
Yeah, and it's a way I've talked with a number of families. I said, how did they talk with their kids about young children about coronavirus? They said, oh, we used the cartoon. Very creative NPR reporters worked with us. So we wanted to leave that material with you. And we thank you very much for your time. And
yes. And Evelyn,
maybe we have time for a few questions.
Yes, and this is Evelyn Blank.
Yes,
I just wanted to thank both of you so much for this incredible presentation, and just how appropriate to also end on self-care, as we're all really struggling through these times to be available to our families, to our clients, to our families. So thank you. And I also want to really thank you for all the work that you've been doing through the coalition, because I think that you've given such thought and preparation to thinking about how to respond to crises, and for networks like us having access to you, and for you being so poised to provide information is just so helpful. So there were one or two questions. One of them was, what are your thoughts about using technology at this time?
Oh,
whether I think through telehealth or whatever. Do you have any thoughts about that?
We all have to get used to connecting in a different way through technology. I can tell you that as a clinician, we're now doing all of our clinical services using technology, and people get used to it. One of the wonderful things now about technology is you can see the person. It doesn't have to be just the telephone or something like that, and it seems to be working quite well. We were involved with using technology earlier with some of our disaster work and found that it was very effective. And the other thing is that for children and families that we've been talking about, allows them to be connected. One of the things that I know is happening in many places is that the companies are providing internet access for people so that they will be able to use the internet to connect in that way. But it's really very important right now for relationships. Jerry, I don't know if you have.
Yeah, just to repeat what you said, I think the nice shift that we're seeing too is that probably people are becoming a little bit more aware of the remarkable benefits that technology can create for interpersonal connectedness. I think people always knew it, but one of the things I've often been concerned about is that the web-based platforms are not a great way to start relationships because they're filled with concern, but they're a wonderful way to continue and sustain relationships. And so people who might not have ever used this platform, grandparents, people who are just not used to this platform are now using it. And I think the second thing is it's being used in an interactive, reciprocal way. It's not just being used to entertain an individual sitting at a screen. So I think both Joy and I, and in our clinical work too, as Joy said, we have found it to be one of the remarkable gifts that have emerged from this crisis. So yeah, I think we think it's, but like everything else, if it's used for relationships, I'm not so worried about using it too much, although there should be limits. But if it's being used just for individual time, I'd keep that as minimal as possible.
Absolutely.
Well, thank you so much.
Yeah, I was just going to add to that I think we're all learning a different way to use it and be connected that is really very supportive and helpful.
Well,
And
I just want to thank you for such a rich
Evelyn,
presentation.
just to thank you, Evelyn. Yeah. I just want to thank you and the TTAC. Both Joy and I have loved this, so thanks.
Yes,
well,
and I want to thank you.
We really appreciate your bringing your expertise. And, I've been part of the Northeast Coalition, and we've been doing a lot of planning, and it's moments like this that we realize the critical importance of really being poised to be able to respond. So thank you so much. We've got tremendous feedback. Thank you all for chatting in your comments. We will be posting both the webinar as well as the slides.
Thanks so much.
Gerard, did you want to add something?
No. I was going to say, and I hope it's appropriate because Joy and I and you felt this, at a time like this, a person about mindfulness we would often rely on is our dear friend Dr. Rebecca Shimon-Shunock. And Rebecca passed, unfortunately, a short time ago, and we just wanted to mention her name and honor her in her absence.
Thank you.
And and Evelyn, I really want to thank you so much for your leadership and passion and commitment to make it happen. It wouldn't have happened without that. So we thank you.
Amen.
Thank you. And we do apologize for the tech problems in the beginning, but please do go back. I know this is a tremendous amount of useful information. It all will be posted on the TTAC website, so you can go back and not only listen to the recording, but also go through the slides as well. So thank you all.
Thanks, Evelyn.
Thank you.
Joy, Take care, Joy.
Yeah, you too. Bye-bye.
Thank you.